So the word midwife means with women, and that's part of the uniqueness about us, is that we spend a lot of time with women in pregnancy and labor and delivery.
Midwife certification is a master's degree in nursing with also an advanced practice nursing license to practice midwifery. So Mayo Clinic Health System employs certified nurse midwives with either a master's degree or a doctorate degree and an advanced practice nursing license that allows them to practice midwifery in a hospital and clinic setting. And that's important because there are other practices throughout the country that midwives do not have the same educational background, and their scope of practice can be different than what a certified nurse midwife is able to do. So the difference to the patient as far as support in labor and care during pregnancy doesn't change, but when there are other concerns or they need a different level of care, a nurse midwife that practices in a clinic and hospital setting may be able to provide and capture resources that are not available to women at other facilities.
We are different than other OBGYN providers in the aspect that medical doctors are trained in surgeries and high-risk situations, and midwives are trained in the natural process of things that go normal and as they should. And we collaborate really well with the medical doctors to provide that great collaborative care.
My role as a certified nurse midwife is different from an OBGYN provider in that I really focus on that personal relationship with each patient, that I like to provide bedside support while they're in the hospital, throughout their entire labor, pushing, birth, and that's really where the heart of midwifery care is providing that personal one-on-one support with them while they're having their baby. Having a baby is the one time that I have seen a child and a patient and a mother and a grandmother and a great-grandmother all come together for the birth experience. It's a moving experience for women of all ages. It's a monumental time in every woman's life to have a baby, and involving all family members, partners, children, grandparents, aunts is part of the whole experience, and it makes that experience for that patient even better.
So the care that we provide with a patient and their family throughout pregnancy is monthly initially, and then as the pregnancy proceeds, we see them more often towards the end of the pregnancy. We listen to the baby and we measure the baby's growth with each visit. When it's time for the baby to actually come, we are at the bedside for most of that process until that baby delivers with the family. We spend a lot of time supporting women in labor, their pain, provide options for them. We were nurses before we became midwives, and so there's this bedside manner that we have in our history that we've spent a lot of time with patients, and that seems to make the difference.